In this video, we will be looking at the rehab protocol for swimmer's shoulder. We will look at rehabilitation exercises. We will look at the steps and process of getting a swimmer back into the pool. The initial part of the freestyle stroke has the shoulder in an extended position with the humerus, abduction and internal rotation. Competitive swimmers can swim up to 20 kilometers a day. This can equate to 3,200 freestyle rotations per day, predisposing swimmers to overuse injuries. Swimming freestyle is performed in a clockwise direction with varying degrees of internal and external rotation, as well as scapular protraction and retraction. During the recovery phase, the humerus is in adduction and internal rotation, moving from extension to flexion with the arm out of the water. Shoulder impingement is a musculoskeletal condition located in the anterior part of the shoulder. It is the trapping of the supraspinatus and the bicipital tendon under the coracoraneal arch during an adducted position. The cause of the injury can have many different reasons, such as overuse, poor technique, scapular dyskinesis, and weak stability muscles. The early phase of the rehabilitation plan is to re-establish full range of motion and decrease pain and inflammation. The rehab program will be working within an early phase, intermediate phase, strength phase, and sport-specific phase. All these phases will ultimately get the patient returning back to sport. It is important for the patient to progress without any pain before moving on to the next phase, as re-injuring will prolong the rehab program. Due to the excessive repetition in a swimming stroke and muscular endurance, the strength program should have these aspects within them. The first exercise for the rehab program is the use of early range of motion. Shoulder impingement limits the shoulder to 135 degrees of the movement arc. The use of range of motion can also help with the progression of the rehab process. Getting full range of motion is important for the swimmer to return back to sport. The patient stands in an upright position, flexing the shoulder while having slight abduction. The patient raises their arms to test for full 180 degrees flexion. The serratus anterior is used to move the body over the arm and rotate the scapula upwards. In addition, the serratus anterior is one of the main movers for the pull phase in freestyle. Using wall sliders will activate the serratus anterior, which will ultimately help with proprioception and strength. The patient then uses the wall to activate serratus anterior. Once activated, the patient then slides their hands up the wall, focusing on contraction. Because serratus anterior is a primary mover in swimming and a muscle used for shoulder stability, it is important that we utilise training this muscle. A recent study done by Nuba reported on an electromyographic study of 7 collegiate swimmers. They showed the importance of strengthening the recovery phase muscles, especially the scapular rotators such as the serratus anterior. The serratus anterior moves the scapula upward and allows it to rotate clear of the abducting humerus. If the muscle fatigues over a period of time, then it would not be as efficient at getting the humerus into position. Therefore, it can cause an impingement. Training the thoracic spine is important for good posture. It counteracts kyphosis caused mainly by the tight pectoral major. The exercise involves the patient being on their hands and knees. The patient then ultimately rotates their thoracic spine. The movement focuses on mobility as well as core control. As well as working on thoracic mobility, it is also working on posture of the scapula. The arm is flexed and by the head, meaning that the scapula is protracted. This is important for the patient to work on posture alignment as well as thoracic mobility. The thoracic spine is used to rotate to breathe in a freestyle stroke. Keeping the thoracic spine mobile is important for the patient when ready to return to sport. Furthermore, the importance of scapular protraction and stabilization is assisted with a more mobile thoracic spine. The chest is one of the main muscles used in swimming, as shown in the mechanics of adducting the arm in the pull-in phase. The exercise shows the patient holding the band comfortably, slightly out of shoulder width. The patient then flexes the shoulder. This begins to stretch the chest. The exercise is working on mobility, increasing range of motion to stop the pulling of the humerus out of glenohumeral joint. It is important for the patient to work on chest flexibility because the pectoral major inserts on the humeral tuberosity. When tight, it can pull the humerus out of position. The shoulder dislocations will stretch the muscle fibers as well as making the chest more mobile in hyperflexed positions. In this rehab program, it is important that we also stretch out muscles that are tight as well as strengthen the protraction scapular muscles. Furthermore, this allows us to work on stretching the bicep tendon. Due to the postural imbalances, the bicep tendon can become tight. Isotonic exercises can be used by contracting the muscles without movement, being able to strengthen by using the wall as resistance, progressions by putting more force into the wall as the shoulder stabilizers become stronger. The exercise above shows the patient working on internal rotation. This exercise focuses on isolating the internal rotators, which can be a cause of impingement. The intermediate phase of the rehabilitation program focuses mainly on increasing dynamic stability, increasing strength, and maintaining full range of motion without any pain. The program then begins to strengthen the stability muscles. The punch-out exercise helps to strengthen the serratus anterior. It has been shown that the serratus anterior is activated past 90 degrees of shoulder flexion. Therefore, this exercise is a good way of targeting a weak stabilizer. Progressions of this exercise would include using a thicker TheraBand. The patient would have to keep their core and hips engaged. Using the TRX allows the patient to control how much stress they use by their body weight. TRX rows allows the patients to strengthen the rhomboids and middle trapeziums. This will benefit in good posture, but also retraction of the shoulder blades. This will also help with opening up the tight chest pectoral muscles. The strength phase in the rehabilitation program increases neuromuscular control, increase overall strength, and dynamic stability. This exercise is actively strengthening the anterior delts as well as the upper trapezium and supraspinatus, all known for scapular weakness. This exercise also assists with postural imbalances. Progressions could include increasing the weight for optimum overload. This exercise is good for targeting multiple muscles at a time. The patient stands upright, engaging their core, as there is a concentric contraction towards the face. The aim of this exercise is to use the TRX as an overload to the rotator cuffs. We try to externally rotate the shoulder where there is weakness in external rotation prior to having a shoulder impingement. Then the press of the exercise is increasing range of motion of the supraspinatus and deltoids. This is a good exercise because it allows isolation of the rotator cuff muscles. It improves scapular muscle endurance as well as it is a sport-specific function. YTWs are important and effective exercise for scapular proprioception. Furthermore, YTWs can be used to strengthen the scapula. The ability to go into different positions allows the patient to target different areas and muscles of the scapula. This exercise also helps with multi-directional instability as it is strengthening the scapula in different places. The patient lays facing down, holding the weight in their hands. Activating the scapula, the patient follows the YTW, keeping the weight off the floor, externally rotating the shoulder, having the elbow flexed to 90 degrees. The shoulder press exercise is used to develop strength in both the deltoid muscles and serratus anterior. Because it is not like a normal shoulder press, it is being performed overhead. The shoulder in fact allows the serratus anterior to be activated. The patient is seen kneeling on one leg as it allows the patients to activate the core muscles. The shoulder then flexes, the biceps then extend the bar. It starts as a concentric contraction and then the shoulder eccentrically flexes the bar back into the shoulder. Getting the patient back into sport. The shoulder needs to learn how to correctly perform a good technique to limit re-injuring. Sport-specific drills can be used to relearn and help aid the rehab transition phase to returning to sport. The thoracic shoulder rotation drill is used for core stability. It's also used for head position and shoulder position when the freestyle stroke progresses. This is a good technique used for reproprioception of the body in the water and where the thoracic spine is meant to be when breathing. This links in with the rehab program as we worked on protraction of the scapula, which is assisted by the thoracic spine. The second drill is used to help internal rotation of the shoulder. This drill focuses on strengthening the internal rotators as it focuses just on the pull section of the stroke. Strengthening the internal rotators is important as it helps stabilize the shoulder, especially how there is a lot of flexibility needed in internal rotation for the pull phase. This drill is a progression from the thoracic spine rotation drill as it now starts to involve more arm pull movements as well as still focusing on thoracic rotation. This next progressive drill is now adding both the catch-up drill and the thoracic spine rotation drill as we start to use shoulder stabilizations for full stroke swimming. This patient's stroke is slow as they're trying to work on stabilization and proprioception of the shoulder. The patient works on hand entry and control of the shoulder arm position over the water. Focus of extension, flexion and internal rotation of the elbow and arm, shoulder and scapular rotators. This drill really allows the patient to focus on their swimming stroke as well as getting feel for the water again. As seen in the video, the patient has a straight arm ballistic type style of swimming. This could vary on this could vary on what type of swimmer you have during a rehab program, depending on what distance they do. Swimmers who have straight arms usually are sprinters, as it is more of a ballistic type style of movement, whereas a long distance swimmer has more of a short arm recovery, so that is less strenuous on the shoulder. Returning to full stroke swimming, the patient will start off slower than usual and work their way up, focusing on their technical aspects of the stroke, such as their pull, hand entry, recovery phase and hand exit, as well as now working on kick,